Hey, also gonna try and start doing another type of weekly video, kind of all about outcome measures. Talking about pick one outcome measure each week, and then talk about it, a little bit of it, and why I use it, what I like to use it for. And I'm not gonna go too much into the statistics behind it because the statistics are gonna be different for every population and diagnosis. So those are going to be things that you can look up on your own, and but I'll link the resources to those below. So the one I wanted to talk about this week to start us off is the 5-time sit to stand, and that's just the reason I picked that one first is I feel like I've been doing it with a lot of my patients recently. So the 5-time sit to stand is a great outcome measure. It's been validated. It's on the American Academy of Neurologic PT EDGE document, so it's highly recommended as a core outcome measure for use with all neurologic populations. And then if you look into the individual EDGE documents, it might be on some more of those too. I don't have those memorized, so I'm not quite sure. But basically, the 5-time sit to stand, all you need is a chair and a stopwatch and your patient. And you want to use a standard height chair. I think it's like 40 centimeters or something like that, 17.5 inches off of the ground, and with armrests. And basically you're going to have your patient cross their arms in their chest, and then they're going to sit down and stand up 5 times as fast as they can. Usually you give them a practice round, and then on the real round you would say go, and then start the timer when you say go. Sometimes if they don't hear me or they take a second before they get up, I will start the timer once their bottom leaves the chair, and then so they do their 5 sit to stands as fast as they can, and then as soon as their butt hits the chair on the last one, hit the timer again. If I remember correctly, the typical cutoff for delineating a fall risk is 15.5 seconds or so. So you can kind of use that as like a quick clinical reference guide if you wanted to inform your patient of, hey, you beat the cutoff this time or something like that. But it's a great outcome measure to use because it's quick. It takes less than a minute to even for the practice trials, depending on how long your patient needs to rest. You can use it to assess not only the activity of sit to stand, but the body structure function of lower extremity strength, lower extremity endurance, motor coordination, and timing, just because all of those can kind of play into it. So if those are things that you're working on in terms of body structure function impairment, if those are improving, they should have some improvement on their 5-time sit to stand. So it's a great outcome measure because it's quick, it's easy to do, you don't need a lot of equipment, it's highly validated through multiple populations, and you can kind of use it to track not only body structure function but also activity. So it's one I like to do. Like I said, I've been finding myself doing it in the acute care setting quite a bit, especially with some of the patients that are maybe a little bit higher functioning. Just because I can do it quick. We sit them up on the edge of bed anyway to do some of their strength assessment, and then, hey, let's go right into a 5-time sit to stand. Gives me a little bit of a baseline in terms of their strength and their endurance, and it also gives me a baseline of where their fall risk might be. So 5-time sit to stand is one of my favorite outcome measures. Easy to do, quick to do, and I just find it really effective with a lot of patients. So hopefully that's an outcome measure that you're using, and if not, you can start using it, and I'll link the resources down below. Thanks for watching.